everyone, I'm Lindsey Beam. I'm a nurse practitioner student at Auburn University, and we're going to be doing a 5 simple suture technique today for our class. So first of all, you'll want to have a clean examination area, and you're going to have the patient and the injury exposed. You're going to want to make sure you discuss what you're fixing to do. Wash your hands, identify your patient by name, date of birth. Ask them what happened and assess the wound. So you're going to want to make sure that your wound is clean and looking for any kind of debris in that wound area so that you'll know where to inject or how you want to approach the situation. So first of all, what we're going to do, we've washed our hands, we have identified our patient. We've got a sterile area at this point. Of course, we're utilizing items that we have on hand for the purpose of this video. I'm going to be putting on my sterile gloves. And at this point, I would also have a nurse or someone to help me. And identifying the wound will also help you identify what kind of sutures that you're going to want to use. Obviously, most of the time in primary care, we're going to be just using non-absorbable sutures, but of course, sutures that would go on the inside of your body would be absorbable, like Vicryl or whatnot. Today, we're going to be looking at using our silk braided, and of course, all of these would be inside your sterile packaging. So, we've got the silk braided, and that's what we're going to do on the simple suture technique for the 4-0. Of course, the higher the number is going to be for areas such as your face, so areas that are thin and easily able to suture. Your lower numbers, 3-0, 2-0, 1-0s, are going to be for your tendons, deep muscles, stuff like that. And then we also have our nylon filament, which is just a different product. Sometimes people cannot tolerate the silk, and so we want to use nylon. And so those are some things that you would want to assess with a patient if they've had sutures before. You're going to want to ask what kind they've had before. So for the purpose of this video, we're going to use just our silk. Again, we've assessed the wound bed, we've assessed what's going on, and we are going to cleanse it. And we want to cleanse our wound with normal saline is fine. So it depends on how big your wound bed is. If you have a large gaping wound, you want to get one of the taller normal salines. You can puncture it with holes at the tip of the bottle and just kind of squeeze throughout the wound, especially if it's a big one, a big wound. For our small area, this is what we're going to be working with today. We're just going to use it, and I do not have a sterile saline bottle with me, so we're just going to pretend like we have normal saline here. We would wash it and we would cleanse it. Of course, we would do all this prior to getting our sterile items out. So that's what we've got. We've also got lidocaine, and so we will use that to inject. That's just for show purposes only. This is an empty needle. We would assess the area if we want to inject inside the wound or outside the wound. And if the wound is really dirty and has a lot of debris, of course, we don't want to go from injecting on the inside of the wound, because we don't want to push any kind of debris throughout the tissue and damage any tissue. So we're going to say that this wound is dirty and has a lot of debris. We're going to go from the outside of the wound, and of course the area has already been cleaned, and so we're going to clean it. We're going to explain the procedure to the patient, let them know it's going to pinch a little bit. We're going to go in from the side, and as we go in, we're not going to inject yet. We want to pull back on our plunger to see if we've hit any kind of vessels. We definitely don't want to inject any lidocaine into any main arteries or veins, because of course it can give heart issues if you did that. So as we're pulling out of the wound, we're going to inject a little bit at a time, and we're moving it side to side, just as so. And before my needle is all the way out, I'm just going to spin it. I'm going to do the same area this way. I'm going to pull back. We're not in any kind of vessel. And as I pull back, I'm going to be pushing in some of the lidocaine. All right, and we would do that on both sides. We give it about 5 minutes. Come back. We would take, you know, our forceps, and we're going to be pinching, see if they feel anything. Then we're ready for the procedure. All right, so patient is feeling okay. We're feeling okay. We've explained everything to them. I'm going to have my needle clamps ready. All right, and again, this is a sterile technique, so this would all have a drape around it in a real life scenario. And what you want to do is make sure you've grabbed so that you can go in at a 90-degree angle. We're going to start in the middle so that we know we have even stitches on either side. And what we're going to do is we're going to use our forceps, and we're going to go in at a 90-degree angle and flip up just like this. All right, and just want to make sure that you're kind of using this other finger so that we're not pulling the entire needle and stuff up to our facial area, because again, this is as sterile as we can get it for our patient. And we definitely don't want this knot to already cause, and sometimes that happens. So we're just gonna cut it off like that. If we get tangled up, want it nice and neat. And as we come out, we want to go in through the next side, okay? So hold it with our forceps so that we are able to get an even approximation, and we're having even sides. And we're going to come in just like this. You can hold it with this area, your finger. Sometimes if you have an assistant, that helps. And then what we're going to do is we're going to take our, to go with our first knot, we're going to wrap it around 2 times, and we're going to grab and pull through, just like that. You don't want to pull too tight and strangulate the tissue on either side. And then we're going to come back over once. Just like that. And we're going to go back one more time. So you want three times. The initial 2 times, and then 3 times the other way. Okay. So, and then we're going to pull the knot to one side. All right. So that's our first stitch. All right, let's keep going. All right, I'm going to start down here so that I make sure that we get a good tight grip on either side. All right, so once you've already gone through this, for the purpose of this video, I showed how we would pull on through and then well approximate it. So once you feel good about doing all that, you can actually go ahead and go on just like this and make sure you're getting the same even sides. So you want about the same sides, and using this will help you make sure that that's approximated. All right, 1, 2, and then pull it through. And we're going to come back this way. And then we want to go this way. So reversing it each time. Alrighty. So there we go. All right. For the purpose of this video, we're doing 5 simple sutures. So, and the wound, of course, on this area is a lot larger wound. So we're going to start right here and pretend like this is the end of our wound. But what you would want to do is start in the middle and then start on either side. All right. That way you don't miss any areas where you could have gaping, so such as this right here. We want to make sure that that's well approximated in the end. All right, so we're going to say 1, 2, and pull it all the way through, and then we're going to go back 1, remember not to strangulate the tissue. And you're in reverse each time. All right, and so far our ties are on all the right side. All right. At the same time, you can be educating your patient on the care post surgical incision closure, or excuse me, suture enclosure. So we don't want to go swimming. We don't want to get it wet for about 48 hours. It may drain a little bit, so they can use an actual Telfa pad. A non-stick Telfa pad until for about 24 hours, maybe 48, but we want to leave it open to air so that it's good and approximated and dried out. No swimming, no soaking it in baths. We really don't want to put any ointments on it because that can actually loosen the sutures. And watch it for any redness. Sometimes, like I said, with silk, sometimes people have a little bit of irritation from the silk suturing, and so you want to tell them that, you know, in the next 24 hours they may actually see excuse me, let me start this over. They may actually see some puffy skin around it. You know, sometimes their skin doesn't love this material, but that's not to be worried with unless it's super red and hot to touch. We would probably want to prophylactically go ahead and prescribe an antibiotic, especially like this wound we said was going to have a lot of debris in it. And so yeah, so that's what we would want to do. So we've gone back and forth. Remember, we're going to tie twice, wrap it around twice, and then we are going to let's see, 1, 2, 3, 4, 5, and we're just, for the purpose of this video, going to say that this is the end of the wound closure. If this was a real patient and we were going to check out for well approximation, we'd want to check all of our knots, make sure they're pulled to one side. We would probably put another suture here, maybe another one here, and maybe one on the end to well approximate that. And that is all. I thank you all for tuning in, and we would just tell the patient to come back, and it's the next 7 to 10 days. So usually on if you have sutures in your like superficial area, so arms, legs, we would say around 7 to 10 days. If they're on a bony prominence such as elbow, knees, we want to keep those in for a little longer, so 10 to 14 days, probably 14. If you have them in your head, sutures in your head, staples, we want to say 5 to 7 days. Thank you so much.